Hi, everybody, and welcome back. This is Susan Houts, the Marketing Coordinator for Aging Matters in Brevard, the lead agency for senior services here in our beautiful Brevard County. As some of you may know, we here at Aging Matters in Brevard are set up to provide resources and services to keep seniors in their homes safely and actively living there as long as possible, because that's really where they want to be. We offer things like nutrition services with Meals on Wheels. We have safety home improvements with ramps and grab bars. We have home care, volunteer transportation, and vets driving vets. And one of the services that we find that is very important is to support our caregivers in the community. So those that are living in the home with their loved one or are responsible for their loved one's care in the home. So by providing services and information and support for our caregivers, then our loved ones get better care. And so today we are very excited to be partnering with Adrianne from Greystone Health Care at the Rockledge Health and Rehab and Viera Health and Rehab offices. And today she's going to talk to us about 3 quick tips for caregivers on the art of falling safely. So very important topic for all of us, no matter what the age. So Adrianne, we're super excited to have you. Please take it away.
Thank you so much. So the top 3 points that I'm just going to go over today is 1, creating a safe environment, 2, proper footwear, and 3, using proper safety equipment. Creating a safe environment, especially if you're a caregiver and you have a senior that you're taking care of at home, there's a lot to think of, but a condensed version of that is really watch out for their balance and their gait, ensure that they are not completely inactive, try to get them out, take walks, maybe a little bit of stretching, things of that nature. Vision, of course, as we age, or even if you're young and have bad eyesight, which is me, but obviously as we age, it gets worse. So just ensure that you're keeping up with going to the ophthalmologist and get the appropriate tripping hazards such as rugs and things like that out of the way. Medications is another one. I cannot stress this enough because we see this so much at both Rockledge and Viera rehabs. Make sure that you have a printout that you can keep in your purse or your wallet stating every single medication that you're on, and bring it to every doctor you go to, not just your PCP, every specialist, because if one doctor doesn't know what other medications you're on, then that really can just cause a lot of fall risk on top of many other risks, leading you to the ER. So we try to prevent that. Of course, environment, like I said, make sure any tripping hazards and things like that are out of the way. If you need help in that sense, you need someone to check the home, see if there are a lot of safety hazards around. Our therapists are more than willing to do a home evaluation, or one of us on our care team are more than willing to help with that. Also, of course, think of those chronic conditions. Obviously, if you have diabetes or stroke or arthritis or things like that, even pain or depression, just make sure that, again, you're going to see the physician or specialist that you need to properly take care of that. Because if you're not managing and you're not treating those conditions that you already have, then of course you're going to be more at risk to fall. And much more, as we all know. Next is proper footwear. Naturally, even though I do love my heels, you shouldn't be wearing them if you don't have a proper balance or gait. We actually say, since we do specialize in physical and occupational therapy, when you come here, not only here, but when you're at home or anywhere, make sure you have sneakers, or if you can have sneakers, non-slick bottoms. You can get those anywhere. Brownings, even online, Amazon, just type in non-slick type bottom shoes. Lastly, to pair with the proper footwear, you're definitely going to want to use proper safety equipment. Again, Brownings is a good one, Walmart, even Walgreens, even Health First Medical Supplies, places like that. That's another thing that you need to ensure that it's at the proper alignment. And for your height and your weight, you need to have it at a certain angle to ensure that you're sitting up properly or standing up properly and walking without shuffling, with, you know, heel toe, making sure you're doing it well. So again, if you need a therapist or somebody from our care team to make sure that your walker or safety equipment is at the proper setting, by all means, you can stop by at any of our facilities, Rockledge or Viera, and we'd be happy to make sure that you have all of this set up in your home to ensure that you are not falling.
Great. That's awesome. We appreciate that information. And also, if I can do a plug for Aging Matters in Brevard when it comes to the medical equipment, we also have a medical equipment bank at our Sunflower House Caregiver Resource Center, where folks drop off medical equipment when they no longer need it. And we just ask people to pick it up and drop it off when they're done. So we have that available. Even though our Sunflower House Caregiver Resource Center in the Merritt Square Mall is closed right now, we do have that service still available, and the phone number will be on the end slide for that. So we have a bunch of wonderful community partners in the community, like Adrianne and Greystone Health Care, right? And the Rockledge Health and Rehab office and the Viera Health and Rehab office. We here at Aging Matters in Brevard, and gosh, there's so many resources here in Brevard County to help our caregivers. And so we appreciate that information. Adrianne, any last thoughts on the art of falling safely?
One last thought: if you do fall, because we all know that everyone's at risk, please make sure that you turn. Don't just fall straight on your arms or your head or anything like that. Try to roll with your turn or with your fall. This way you're not, you're less likely to break any bones.
Wonderful. So there's a lot that goes on to all of this. Stay tuned again here on our website, our Facebook channel, and our YouTube channel as we share more 3 quick tips for caregivers. Adrianne will hopefully be back with us here with our 3 quick tips, and also a longer caregiver conversation with Beth at the Sunflower House, all set up to keep our caregivers feeling supported, to have places to go for resources, all in the goal of keeping our seniors active and safe, living at home where they really want to be. Adrianne, thank you so much for your time today.
Thank you for having me. I loved it.
Good. All right. We'll see everybody soon. Thanks so much.